As Jade said, my name is Mary Ellen Knaebel. I'm the Director of Health Promotion and Education at Hamilton County Public Health. And today we're going to focus on the WeTHRIVE initiative. Just for a frame of reference, in case anyone isn't familiar or from Southwest Ohio, but Hamilton County Public Health serves Hamilton County. So we're in the southwest corner of Ohio. There are multiple local health departments in Hamilton County. So as the county health department, we serve everyone outside of the city of Cincinnati, Norwood, and Springdale. So we serve the other remaining 45 political jurisdictions. So you can see that on the map here. So as we talk about WeTHRIVE, there are kind of three initiatives that fall under the WeTHRIVE umbrella. We have our WeTHRIVE Community Initiative, our WeTHRIVE School Initiative, and then our WeTHRIVE Childcare Initiative. And the goal of WeTHRIVE, as Jade mentioned, is a community-driven initiative to create a culture of health, safety, and vitality throughout Hamilton County. And so we'll talk today about what this means and how we have operationalized it at the health department. So WeTHRIVE's journey, we are in our 16th year. So 2009, WeTHRIVE started with funding from the Centers for Disease Control and Prevention. And we initially were focused just on chronic disease prevention. In 2014, we relaunched the WeTHRIVE initiative. All of our grant funding had ended at the end of 2013. And so in 2014, we had support from our Board of Health to relaunch the initiative. And we were able to, at this point, expand out beyond chronic disease prevention to really look at all aspects within a community or a school that impacts the health, safety, and well-being. In 2017, we received a NACCHO Model Practice Award. And so NACCHO is the National Association of City and County Health Officials for our kind of strategies utilized within WeTHRIVE, how we engage the communities and the partnership and the power sharing that kind of exist within the WeTHRIVE initiative. And then as we look at the end of 2024, we had 25 WeTHRIVE communities and 8 WeTHRIVE schools. Also in 2024, we relaunched our childcare initiative, and we have 10 WeTHRIVE childcare providers. So here's our map. We are throughout Hamilton County, east, west, north, south. We work with a wide range of communities and schools and childcare providers throughout the county, and so have a lot of diversity in the communities that we're working with and that we're serving. So what is WeTHRIVE? We kind of talked about what the goal and the mission of it, but what is it? So it truly is a partnership between Hamilton County Public Health and local community schools and childcare providers to create that culture of health, safety, and well-being. The goal and the mission of WeTHRIVE is intentionally very broad. Health, safety, and well-being can encompass a lot, and that is intentional because the needs of every community or school that we're working with are different. And so WeTHRIVE provides that framework so communities can work on what is important to them and what their current needs are. And we recognize that community members, school members, childcare providers are the experts when it comes to their community and school. So that is very critical to the success of WeTHRIVE. We come in and partner with the community members or the school members as we understand public health and might know some of those best practices. But really, when it comes to communities and schools, those who live and work in those communities and schools every day are the experts. So what does WeTHRIVE provide? So these are the 4 pillars of the WeTHRIVE initiative. We provide support. We have a population health specialist assigned to each community school and childcare provider team that walks with that team through the WeTHRIVE process and kind of just helping them in whatever that looks like. Collaboration. So we connect with other WeTHRIVE teams as well as partners. We have what we call the WeTHRIVE Learning Collaborative, which is a quarterly learning opportunity for all of the WeTHRIVE teams to come together. We provide some sort of kind of education or overview, and then also networking opportunities. And then we have over 50 partner agencies in Hamilton County that have committed to the WeTHRIVE initiative. And so they provide support and technical assistance that, we can't always provide. So as we get on the next couple of slides, you'll see kind of all of the focus areas in WeTHRIVE for the different initiatives. And so as we look at health, safety, and well-being, like that is broad and vast. My team is not experts in everything that can come under there. And that's where we really rely on our partners to be able to provide that individual TA and kind of the focus TA. We look at data. So through the health department and through our EPI team, we have access to different data that we can help provide to the communities and the schools and the childcare providers to help them kind of show what the data is saying related to their kind of needs or opportunities. Not always does, there are times that the data may not match up to what a community is saying the need is, and that's okay. Data tells us part of the story. So on an annual basis, we release data profiles that just provide a high level overview of kind of demographics and some other factors within that community. And then we do community health assessments for the WeTHRIVE communities. And so those we used to do 2 a year. And starting this year, we've kind of changed the process, and all communities will be getting those every 3 years. All of our data profiles and previous community health assessments can be found on the WeTHRIVE website, and that link is at the end. And then the last pillar is recognition and celebration. And so we know community work is hard. We know that it can take a while to see changes and the impact of the changes, especially as we're looking at policy and system changes. But we want to celebrate everything along the way and all of the steps of the journey, be it there's a new team member, or they have gotten back together after maybe taking a pause for a couple of months, up to that policy and implementation piece. So as I mentioned, WeTHRIVE is very broad. And so these are the community focus areas. And so that foundations of a healthy community is kind of that starting point. And so all of these different focus areas kind of work to create that foundation, to create thriving environments where all residents live, work, and play. So we have 6 pathways: chronic disease, emergency preparedness, environmental health, injury prevention, social connection, and harm reduction. And then there are various focus areas underneath. And so as new communities come on, or as communities kind of go through the WeTHRIVE process, we work with them to identify what are your interests, what are your passions, what are you seeing as needs within your community, and where might that fall in one of these focus areas. We also may do some assessments or environmental scans to get a sense of like what we see as assets and opportunities within these different focus areas, and can make recommendations as well. But again, it's what the community thinks is going to is where we're going to start, and kind of where they feel like what is going to be most impactful. The WeTHRIVE school focus areas are very similar. These align to the school health index from the Centers for Disease Control and Prevention, and kind of the CDC's framework of whole child, whole school, whole community. But alcohol, other drugs, cross-cutting factors are really kind of some of those environment, staff wellness, things that kind of go across multiple of these focus areas: chronic health conditions, nutrition, physical activity, safety, sexual health, and tobacco. And then finally, the WeTHRIVE childcare focus areas look at nutrition, outdoor play and physical activity, screen time, oral health, farm to table, and breastfeeding and infant feeding. So again, all of these focus areas are very similar, and there are similarities across all 3 of the initiatives, but then we tweak them a little bit to best meet the needs of that sector. So as we look at the WeTHRIVE process, this is more specific to a community team, but the process is very similar for the school and childcare teams. So the first step is adopting a resolution for communities, or signing a letter of support for school and childcare. And so this is the elected official, so the governing body of that community, be it trustees or the council, kind of making a commitment to WeTHRIVE, recognizing that there is value in partnering with Hamilton County Public Health, and that they want to really look at the health, safety, and well-being of their community and identify opportunities to enhance that. WeTHRIVE is a partnership, and so it's not the health department coming in telling communities or schools or what to do. It's us working together. And so having that resolution from the community or school perspective helps to set the foundation for that partnership, and helps to say like, yes, we are committed and we want to be a partner in this. The next is forming a team. And then we do some sort of community assessment. And so this could be a community mapping exercise where we're looking at all of the different focus areas and understanding what is happening and what is existing within those focus areas within the community, to help us maybe see where there is momentum. Here are areas that WeTHRIVE could really tap into. Where is there maybe not as much going on and the community wants to focus on that. And then depending on kind of timing, also utilizing the environmental scans we do as a part of the community health assessment. And then identifying where they want to focus. So we can look at those focus areas. And we encourage teams, there isn't a specific number of focus areas that teams are required to work on. It's kind of whatever makes the most sense for the community. So usually it's anywhere from 1 to 3 focus areas where a team is working. Once we've kind of gone through that initial stuff is usually what we say is year 1. So right as a community is coming on, we're taking a lot of time to really lay that foundation, form the team, figure out the structure that's going to make the most sense for that community. And I'll talk in a couple slides about what those structures look like as we look at the different teams. Getting that baseline kind of assessment of what's happening within the community and where does the team want to focus. As we move into year 2 and future years of teams, we have assessments for all of those focus areas. And so there's 2 components to those assessments. One is kind of getting the community's experience. So looking at all of the public health best practices, like in an ideal community, what should exist to help support that focus area? And so looking at, do community members see that? Is there lighting for sidewalks? Are sidewalks well maintained? And then we also have an admin piece that looks at what policies and plans exist to support those different pieces. What we have learned is, moving towards those policy and system changes is what's going to create the sustainable change for generations to come. But that policy change is often coupled with kind of the team working on some education, some awareness, and making those changes or environmental changes within the community. After we do that assessment, we will provide recommendations back to the communities or schools based on the assessment. And part of that assessment process is collecting ideas from the team. So our recommendations back are a combination of those public health best practices, as well as what teams have said or identified through the process. We work to create a 2-year action plan outlining kind of what their goals are, how are we going to achieve that goal, who's responsible, and the timeline. The action plan is a very fluid document. We know that it's going to change, priorities and communities change, capacity changes, who's at the table changes, but having that action plan provides that blueprint for how we're going to kind of achieve what they identified, and allows us to kind of measure progress along the way. And then as we look at implementing the action plan, what are the partners or resources needed, and how can WeTHRIVE help connect them to those? And then providing those updates as well as celebrate, which is one of the pillars I mentioned earlier. And every year we hold an annual recognition event for all of the WeTHRIVE teams to celebrate their accomplishments. And so WeTHRIVE is really a continuous cycle to help support each community's progress towards that culture of health, safety, and vitality. As I said, community work ebbs and flows. And so there could be teams that kind of have to stay, we do an assessment and then we realize maybe that's not the right assessment, or the team changes. And so we go back to redoing an assessment. So while we have this framework, it looks very different in each community or school that we're working with. So who are the WeTHRIVE teams? This is more specific to the community teams, but as we look at who's involved in teams, these are some of the partners or different sectors that we look to involve in the WeTHRIVE teams. And so the structure that we encourage teams to have is kind of a hybrid structure. So having a combination of an elected official, someone from the community's administration, as well as residents, business, law enforcement, in all of these different sectors. We have learned over the past 15 years that structure does not work in every community, and that's okay. So some teams are strictly administration teams, and so they are made up of, elected officials, the township administrator, or staff from different departments within that community. And that works. And for those teams, what's really critical is that we're getting other avenues for community feedback and to kind of get for the community to share those ideas. And those teams are working to identify those opportunities. We have a couple teams that are 100% residents. And so they are resident run. And then they have mechanisms in place to make sure that they're keeping their council and their elected and their community administration up to date of the progress. WeTHRIVE ultimately is a partnership between the health department and those elected officials. And so if elected officials, the administration within the community kind of can appoint the resident run team to be WeTHRIVE. That works really well, but it is important to have that feedback loop so that they know what's happening within the team. And then also the team is supported as we look to work on various policy initiatives. So what is the role of public health? We are a connector. So connecting the team to different resources that may be needed, connecting the team to data, or just kind of being able to share that public health expertise and knowledge that we have. Creating that sense of belonging. So as we look at creating this culture of health, safety, and vitality throughout Hamilton County and within all the WeTHRIVE communities and schools, we want there to be a sense of belonging. We want all individuals and all residents to feel welcomed and that they can be a part of that community and that their ideas and their feedback is valued. And then we also have that population focus. And so really kind of moving away from the individual and kind of looking at what can we do to create long-lasting changes that's going to impact this entire community. And that's really where those policy systems and environmental change strategies come in. The individual education on the 101 is really important and plays a role as we look at overall health and wellness within a community. But that's not kind of the focus of WeTHRIVE or the focus of public health. We're really looking at those population level changes. How do we create policies to make sure it's sustainable? So policies could be something around, tobacco free parks and parks for communities or grounds for school districts. And so making sure that as kids are playing at parks that, they're not being exposed to tobacco or other products. It could also look, from an active transportation lens, it could be looking at complete streets and making sure as roads are being designed or repaved and updated that they're taking into account all users. So I know I talked a little bit about power sharing. And this is one of the key tenets for the WeTHRIVE initiative. And so, like I said, we recognize that community and schools are experts within their community and school, and same for childcare providers. And so those are key champions, and our team members have bring a lot to the table, and their expertise is valuable and a key component of the initiative. So this kind of looks at how we kind of share the power with communities. So as the health department, we have the WeTHRIVE process and the framework. The community teams are then selecting the pathway or the focus areas that they want to work on. While we provide best practices and recommendations, the community team is identifying which of those strategies they want to implement, or if they don't feel like any of our recommendations make sense for their community, then they're coming up with us and kind of co-creating the strategies that they want to implement. We know that sometimes, what we're seeing in the data doesn't align to what they're experiencing in their community and school. And so that's okay. Like I said, it's part of the story. And so if they don't want to do any of our recommendations, they're not required. They can kind of identify what makes sense for them. We provide those connections to WeTHRIVE partner organizations as the teams are identifying the strategies to implement and building out the action plan. They're identifying the timeline. And so, what might be something that we think could take 3 months to complete, they may come back and say, no, this is going to take us 6 months to a year. And so they're in control of all of those components. And then, like I've said, we bring that public health expertise, and they're bringing the lived experience and community knowledge to the table. So what are some of the factors of success that we've seen over the past kind of 15 years? So building relationships that foster trust. WeTHRIVE would not be successful if it was not for the relationships that we have with all of our teams. Truly, we cannot do this work alone, and that's, that is the premise of WeTHRIVE, right? Like I keep talking about, it's a partnership, and partnerships require relationships. Building relationships is challenging, right? We are the health department, we're the government. Folks have had different relationships or interactions with government or public health. There is the regulatory aspect of our agency that's going into restaurants to inspect and make sure that they are up to standards and codes. Our water quality team is working with homeowners that may have septic systems and making sure that those are working properly. So there's lots of different interactions that the public can be having with public health. And so we have to build relationships. And so they have to come to know and trust us and realize that we are truly everything that we're saying, that we're not coming in to say, this is what you have to do, but we're coming in to partner. And building those relationships means showing up consistently. And just having that presence. And so there are times when, we are just going and having meetings. And while we might have some things from the WeTHRIVE perspective that we're trying to accomplish, to kind of keep moving through that process, that's not where the community is. And so then we're meeting them where they are, and kind of working through whatever their current challenges are. It could be showing up to council meetings just to have that presence. It could be showing up to various community events, and really just kind of consistently checking in and seeing how things are going. I often joke that my team does not take no very well or very easily. Like we don't give up. You can not be responsive to us, but we are also going to respectfully and professionally still keep reaching out to you and checking in to see how things are going as we build that relationship. Acknowledging the expertise that everyone brings to the table. So everyone is bringing different lived experience, professional experience to the table, and all of that is valuable and plays a role in kind of the success of the team and being able to achieve what the team had identified and the goals. I encourage my staff to kind of, make sure that they are checking themselves, in a sense, as they are coming to that table and really like creating those environments where everyone is feeling valued, and that, they are not expected to know everything and that they can't know everything because we don't have the lived experience because we are not in those communities or schools every single day. Again, focusing on that partnership. It is not us coming in and telling communities what to do. That was in the early years of WeTHRIVE and some of the communities that we were working with. Folks thought we were going to leave. We were there because we had some grant funding, and then we would just be gone. And so it took a lot of just continuing to be there and have conversations and listen to them and understand where they were, to really prove like, no, we're not going anywhere. And 15 years later, we're still working with those 3 initial communities. Meeting communities where they are, and this kind of has multiple purposes or multiple meanings. One, meeting them where they are in terms of that like physical space. So all of the WeTHRIVE team meetings, for the most part, take place in the community, in spaces where folks feel comfortable and are safe spaces for them. Up until COVID, everything was in person, and then with COVID, kind of we had to switch to everything being virtual. And so we still do use online kind of virtual meetings where they're appropriate or having hybrid opportunities, which really just has provided us with an opportunity to continue to have that engagement. But also meeting communities where they are in terms of capacity for change. And so again, it's listening to those communities to help them figure out, okay, we may have some really big dreams and things that we think that communities can do, and they just may not be there. They might not have the right people at the table. There might be other priorities within the community or the school that's taking their focus elsewhere. And so it's really just kind of meeting them where they are, working through the process in a way that makes sense for them. Where we can align to community projects or other community partners or organizations in the community also helps, because then you're bringing in additional momentum. And so WeTHRIVE, again, intentionally is broad so that it can align to anything that that community is working on. And so the more that we can align all of the initiatives, it helps with that capacity component as well. And for us, the teams don't have to be called WeTHRIVE teams. There's a couple communities that have different names for their WeTHRIVE teams, because that's the structure that works for their community. And so that, that works for us. As long as we know that that's the team that's doing it, WeTHRIVE doesn't have to be in the title. Having champions and or neighborhood navigators. So we've had the opportunity to have neighborhood navigators who are community members that receive a small stipend. And they kind of help to be an extension of our staff out in the field, and helping to recruit and engage new folks, helping to lead and facilitate the team meetings, and to really kind of be that champion pushing forward the action plan. But also knowing who the champions are in the community or in the team, so that they can help continue to be the voice. Sometimes there will be, individuals in the community or school that's not going to listen to anything that we as the health department says. But if you can have someone that they trust share the same message and encourage them to come to WeTHRIVE, or to encourage them to provide their feedback or participate in different things, it's going to go a lot farther. As I mentioned before, acknowledge how government agencies can be perceived. We are public health, we are government. There's no getting around that. And so just being upfront with that and transparent goes a long way. Being authentic, we've kind of hit on that throughout this. And then also just leaning into the ebb and flow of community work. As I'm sure you guys all know, as you're doing community work or doing prevention work, it is hard and challenging, and there are ups and downs and all around. And sometimes people, get burnt out, or community members have shifts, or there's changes in the staff or priority shift, which all of that can impact us being able to move things forward or kind of feel like we have that momentum. But knowing that it exists kind of helps so that we maybe don't feel as surprised or shocked when it happens, but then also knowing that it's going to change again. And so they might just need a break for a couple months, but we'll be right back at it. And we're not going anywhere in that process. So on the flip side of that, challenges that we experience in doing this work, competing community priorities. So again, that goes back to the more we can align to what is important to the communities, the less you're going to see this. But this often happens, and those priorities shift. There could be different, either, there's a change in administration, so the priorities shift, or there's kind of some emergency that comes up. And so it's really just being able to lean into that, and figure out the opportunities for WeTHRIVE to support through all of those priorities. We are not in control of the timeline, strategies, and activities. Again, that is a tenet of WeTHRIVE, and something that we are very adamant is important to be a part of the WeTHRIVE, but it can pose challenges because it can feel frustrating for us or for our staff to feel like we're not moving forward, we're not doing anything because we're not in control. There's only so much we can do. There are differences in community versus public health timelines or priorities. Again, this goes back to the data not matching up to what maybe the community is saying is a priority. And so WeTHRIVE is data driven. We want to be data informed. We want to be working on strategies that is going to have the greatest impact. But we also know that data is not the entire story. And so there are other priorities, but it can be challenging to feel like, okay, we're showing you all of this. How do we address these needs when it's not falling on the radar of the community or the school? And really the best way that we have found to do that is through building those relationships and trust, and then continuing to go back to what the data is saying as we're working on the community's priorities or the school's priorities that they've identified. It was probably 10 or so years ago at this point, was presenting a community health assessment. And I had a community member kind of stand up and say, this data is not true. This is not what's happening in our community. like we don't agree with you. And so I could, acknowledge like, okay, I understand, like your lived experience might be different, but this is part of what's happening in your community. And this is, the data there is some truth to this data. It may not be what you're seeing every day, but it is a part of that story. And then as I continue to build a relationship with that individual and work with them on WeTHRIVE, they were later coming around and saying, you were right, like this data was correct. We weren't in a place to hear it. And we didn't want you guys just coming in and telling us everything that was wrong within our community. And so being able to say, hey, here's what we're seeing, but you're not alone in this journey, really helps in kind of being able to address those concerns, and for folks kind of being willing and then able to come around and recognize some of those changes. Changes in key champions, again, staff change, community members change, there's different things happening in personal lives. And so sometimes when you have those changes in key champions, it feels like you're starting over, but the relationships that have built do kind of continue and maintain throughout. Burnout and fatigue, just within our own staff, but then also within community members or administration. And then community members feeling like maybe they're not always making progress. Again, like I said, it can take a while to see some of the changes. And so that's where for us, that celebration and recognition is really important, and making sure we're highlighting that throughout the entire journey. So just some things communities have said about WeTHRIVE. WeTHRIVE is very engaging and continues to work with us on the needs that are essential for our community. WeTHRIVE staff guide us through understanding the resources and capabilities we could develop within our community, and always allowing us to implement what we need. So again, kind of that relationship, and it's not us going in and telling them what to do. We listen to the village needs. WeTHRIVE is a great way to meet your neighbors. I love my community and I love the work WeTHRIVE does. So as we continue to look at kind of where we've gone over the past 15 years and where we hope to continue to go, these are some of our next steps of kind of the initiative, updates to meet the needs in the communities of the school. We know those needs are ever evolving. So how do we continue to make sure we're making updates to the initiative and kind of staying ahead of it as much as we can so that we can best meet those needs? Identifying additional partners to support the initiative, continuing to always expand out our evaluation of the initiative and the data that we have, and then continuing to expand out our policy and system approach, especially around built environment and food access. So as we look at that connectivity, how are folks getting to everyday destinations in their communities? What do we need to be doing to make sure that folks have access? And then also some of those food access pieces to fruits and vegetables. And then the last thing I wanted to share as we kind of wrap up before we move into questions is at the end of last year, we had our 15-year celebration. So we created a video to celebrate the 15 years. And I think it does a good job kind of summarizing the work of WeTHRIVE, and then also getting to hear from communities and schools and childcare providers the impact of WeTHRIVE. So hopefully this works and you can hear it.
For the past 15 years, schools, childcare providers, elected officials, churches, and people like you have come together under WeTHRIVE, an initiative of Hamilton County Public Health that is set on making wellness a reality for all of Hamilton County. It all began with a grant from the Centers for Disease Control and Prevention to reduce the chronic diseases that were impacting our health. This movement to promote healthy eating, physical activity, and tobacco-free living started with 3 communities in 2009. With additional grants, WeTHRIVE soon expanded to other Hamilton County communities. When grant funding ended at the end of 2013, WeTHRIVE was re-envisioned and expanded with support from the Hamilton County Board of Health. Our mission? To create a culture of health, safety, and vitality throughout Hamilton County. In 2014, many of the original communities recommitted to the movement, and 5 new ones came on board. From 2015 to 2019, WeTHRIVE continued to grow. More communities signed on, and school districts became involved as well.
initiative.
Today, the WeTHRIVE initiative includes 25 communities and 8 school districts. In 2024, we relaunched the WeTHRIVE Childcare Initiative, and 7 providers came on board. Tonight, thanks to the people in this room and those who came before you, we're celebrating all that you've done to make Hamilton County a healthier and safer place to live, work, learn, worship, and play.
Over the past 15 years, WeTHRIVE childcare providers, communities, and schools have made meaningful and sustainable changes, making healthy living easier for generations to come in Hamilton County. They've adopted policies so that we can all breathe clean air while enjoying parks, playgrounds, and other outdoor spaces. New and updated playgrounds and parks give people a safe place to engage in physical activity and connect with their neighbors. Communities and schools took steps to ensure that everyone can safely walk, bike, or roll to get where they need to go. School and community gardens provided fresh and healthy produce for residents and students. School districts adopted and updated policies that made healthy food choices and overall wellness a priority. Schools and communities also found creative ways to ensure access to healthy foods. WeTHRIVE schools set up systems to ensure access to mental health support and resources for students and staff. Communities adopted policies and launched programs that had a positive impact on the environment. Finally, WeTHRIVE childcare providers implemented practices that help young children and families build healthy habits for life.
Those changes and more were made possible by you, the people who make up WeTHRIVE childcare community and school teams. What better way to celebrate WeTHRIVE's 50th anniversary than hearing about it in your own words?
To me, it's very special. I am a part of the Delhi community. I grew up here, I went to school here. So being a part of the WeTHRIVE Delhi team means a lot. It helps me stay healthy, and it really means a lot to me to give back to my community, my friends, and loved ones.
To me, WeTHRIVE means working as a team to execute different initiatives throughout the community with schools, the youth, and their families.
WeTHRIVE, I feel like, kind of combines two of my interests of healthy living and giving back to my community, and so it allows me to kind of do both.
I was inspired because I was on the district wellness committee, and we got to see how the WeTHRIVE team could help best support our district and community as a whole, working alongside our initiative.
WeTHRIVE initiative means so much to me because it is a way to bring people together, to help people to become and sustain good health.
I've been so honored to be a part of the WeTHRIVE initiatives that bridge the gap of a healthier, safer, and engaging environment and place for us all, families, individuals, the whole community.
I'm learning a lot about our community. I'm getting to work with some awesome people like Olivia and Kat, and all the people that are members of WeTHRIVE. We just have a great time and we enjoy helping our community.
Yeah, I love being a resident of the Hamilton Village of Woodlawn, and I love the fact that we are aligned with the Hamilton County Public Health, with the WeTHRIVE initiative to make sure that our neighborhood is growing, that our neighborhood is educated, and all of that data that lets us know what we have going on in our community.
WeTHRIVE has been great in helping us understand where we are, but also where we can be as far as health, wellness, and social connectedness.
WeTHRIVE has been extremely helpful keeping our school aligned with required policies, guidelines, and assessments around wellness.
All village property is now tobacco-free. We passed an ordinance in 2018, so we are now a tobacco-free community.
The resources that WeTHRIVE provides with emails and during our every other month meetings has been nothing short of amazing.
Not only are we unifying within our own community, but it's very unifying to get together with surrounding communities.
A lot of this, it either wouldn't have come to fruition or would have been a lot slower without Hamilton County Public Health. So I'm so thankful that we are a WeTHRIVE community.
We also asked team members to describe WeTHRIVE in just 1 or 2 words. Here's what you had to say.
Connections.
Organized.
Incredible. Health.
Unifying,
Amazing.
inspiring,
Excelling.
Community, partnership, togetherness.
Fun.
Outreach.
Grassroots.
Collaborative.
Priceless.
Happy 15 years, We Thrive.
Okay, well, thank you for that